السلام عليكم. أنا الدكتورة إيمان شفيق شافعي، مدرس طب الأطفال بمستشفى بوريش الجامعي جامعة القاهرة. النهاردة هشرح لكم محاضرة Juvenile Dermatomyositis. The definition: Juvenile dermatomyositis is a systemic autoimmune inflammatory muscle disorder and vasculopathy that affected children younger than 18 years. GDM primarily affects the skin and the skeletal muscles. It presents as a proximal symmetrical muscle weakness with vasculitis affecting the skin, muscle, and internal organs. The epidemiology of the juvenile dermatomyositis. Juvenile dermatomyositis is the most common idiopathic inflammatory myopathy of childhood, accounting for approximately 85% of the cases. The peak incidence is from 5 to 10 years of age. Girls are affected more often than boys. It is classified into two types: classical juvenile dermatomyositis and clinically amyopathic juvenile dermatomyositis. The classical juvenile dermatomyositis is characterized by the presence of cutaneous and muscular and extracutaneous manifestation, but the clinically amyopathic juvenile dermatomyositis is characterized by the presence of cutaneous manifestation only, but there is no muscular manifestation. Its etiology: the cause is unknown. Both genetic and environmental factors play a role in the pathogenesis associated with HLA DR3 or DR5 or DR7. Its pathophysiology: GDM is an immune-mediated disorder with proven immunohistopathology and response to immunosuppression. The typical histopathological findings of GDM in muscle include perifascicular atrophy, endothelial cell swelling, vessel wall membrane attack complex deposition, capillary necrosis, infarcts, major histocompatibility complex upregulation, and the presence of an inflammatory infiltrate consisting of T and B lymphocytes, macrophages, and plasma cells. Its clinical presentation: the most characteristic findings include cutaneous manifestation as Guttering papules, heliotrope rash, calcinosis cutis, and symmetrical proximal muscle weakness. دلوقتي هنتكلم على cutaneous finding. It occurs 2 to 3 months prior to the muscle weakness. ده شكل الheliotrope rash. It is the first cutaneous sign. بتبقى periorbital, symmetrical, violaceous patches with or without edema. ده شكل الجوترين papules. The Guttering papule, it is violaceous papules overlying the following joints of the dorsal hands: metacarpophalangeal joint, distal interphalangeal joint, and or proximal interphalangeal joints. الصورة دي هتورينا المالر rash. الإريثيما of the central face usually doesn't spare the nasolabial fold. وكمان الجوترين sign in both elbows, which is violaceous symmetrical macular erythema over the bony prominences of the hand and elsewhere, as in the elbow زي في الصورة بتاعتنا، أو النيز أو الميديال malleoli. This picture shows the V sign, which is the macular erythema of the V area of the neck and chest. This picture shows an erythematous violaceous scaly rash is present over the extensor surfaces in a child with juvenile dermatomyositis. This picture shows calcinosis cutis, which is the cutaneous calcium deposition, usually in the areas of trauma, as in the elbow. دلوقتي هنتكلم على extracutaneous finding في حالة juvenile dermatomyositis. General systemic disturbances as fever, arthralgia, malaise, weight loss, and Raynaud's phenomena. Proximal symmetrical muscle weakness in the shoulder and the limb girdle, which present as the patient find it hard to raise their arms, to comb their hair, or walk up the stairs due to proximal muscle weakness. Dysphagia and or dysphonia due to the involvement of the esophageal and the pharyngeal muscles. There is also pulmonary diseases as restrictive lung disease from the respiratory muscle weakness and interstitial lung disease, which is the leading cause of mortality. Also, there is synovitis, cardiac diseases as tachyarrhythmia, dilated cardiomyopathy. نيجي بقى للdiagnosis of juvenile dermatomyositis. Diagnostic criteria for juvenile dermatomyositis include the classic rash, heliotrope rash of the eyelid and the Gottrin papule, plus 3 of the following: weakness, which must be symmetrical and proximal; muscle enzyme elevation may be more than one, as creatinine kinase, aspartate aminotransferase, lactate dehydrogenase, and aldolase; electromyographic changes; and muscle biopsy, which shows necrosis and inflammation. نيجي بقى على الانفستيجيشن بتاعت الجوفينايل ديرماتومايسايتس. هنلاقي في اللابوراتوري تيست during acute active phase في elevation of the muscle enzymes levels as creatinine phosphokinase in 65%, most specific aldolase in 40%, and AST, ALT, and lactate dehydrogenase. Also, there is anti-nuclear antibody positive in 40% of the patients. برضو المفروض اعمل investigation للمسل زي esophageal manometry. Electromyogram studies are useful early in the disease and show abnormal finding in 70 to 90% of the cases, but are non-specific and can be seen in other muscle diseases. Imaging studies as MRI or ultrasound of the muscle barium swallow, muscle biopsy. Also, we have to do other investigation for the other systems of the body, as it is a multi-system disease. We have to do pulmonary function studies, typically reveal a restrictive disease pattern. The forced vital capacity or the total lung capacity is less than 80% for the predicted for age. High-resolution CT scanning is very sensitive for the detection of the interstitial lung disease, and also ECG. نيجي بقى للمانجمنت بتاع GDM. The therapy for muscle components of GDM involves the use of corticosteroid, typically with an immunosuppressive agent. The systemic steroids are used in acute and severe stages, then shift to oral steroids. As prednisone, the dose is 0.5 to 1 mg per kg per day, increased to 1.5 mg per kg if the lower doses is ineffective. Taper when muscle enzymes approaches normal. علشان الستيرويدز سايد افكت فما اقدرش امشي عليها طول العمر، فلازم ازود اميونوسبريسيف ايجنت علشان تساعدني ان انا بعد فتره لما الديزيز يبقى ستيبل ان انا اعمل جرادوال ويزدرول للستيرويدز واكمل على الاميونوسبريسيف ايجنت. فعشان كده بنسميها جلوكوكورتيكويد سبيرنج ايجنت زي الميزوتريكسيت والمايكوفينوليت موفيتيل or azathioprine are used first line as glucocorticoid sparing agent for muscle involvement. The response rate to the methotrexate have been reported to be approximately 70 to 80%. وممكن برضو بستخدم الاميونوجلوبولين وبلازمافيريسيس في السيفير cases. Therapy for the skin disease includes the following: sun avoidance علشان الشمس بتزود الاكتيفيتي بتاعت المرض بتاعنا، وسان سكرين and photo protective clothing، فلازم اتجنب ان انا اتعرض للشمس فترة طويلة، وحتى لو مشيت في الشمس احط سان سكرين والبس photo protective clothing. Topical corticosteroids و antimalarial agents as hydroxychloroquine and chloroquine, methotrexate و surgical excision of the focal and tender calcinotic lesions. Thank you.